Gloves off. Hey, everybody. My name is David Rice. I'm the chief editor here at DentistryIQ with
Katrina Sanders, the dental hygienist. Hello, hello.
I am so excited that we're doing this together, Katrina. I know we have a series of topics to go over, which are really relevant all day, every day. And our first topic today is finding the magic minutes. That's never a problem.
Never. I mean, all dental hygienists run on time. All doctors run on time. So I don't know why we even need to talk about this, right?
I can picture my entire hygiene team doing this.
Hello. We always love to give the doctor that look when we're running behind. But to your point, I think these magic minutes, so to speak, are so important. How do you find those times to be able to optimize the work that we do? So the first thing that I'm going to say right out the gate is you can find those magic minutes if you're taking the time to effectively assess, diagnose, communicate, and treat the patient. There's incredible amounts of data out there that indicate that the amount or prevalence of periodontal disease, for example, across the United States versus the amount of prophies, D1110s that we perform on patients is not in alignment. So my first thought, and this is of course a provocative idea, but my first thought in all of this is maybe we find the magic minutes in sitting down and talking to our patients about what we're seeing. Maybe we need more time to counsel our patients on nutrition. Maybe we need more time to counsel our patients on tobacco cessation. Maybe we need more time for oral hygiene instruction. And subsequently, hygienists out there, maybe we need more time instrumentating our patients. If we do, our first step, at least for me, in finding those magic minutes is to talk to the patient about what you're seeing and to reasonably let them know about the disease process that they have in their mouth. So I think from a magic minute standpoint, that's huge. You buy yourself the time, the opportunity to shorten that recare for that patient, to really talk to them about the level of disease and to have the amount of time to treat the disease that's sitting in your chair. I think another piece early on that we need to consider is the concept of transformative learning. Hygienists are patient advocates. And what you do from a front-loading standpoint to educate your patient will provide high-level value down the road. So when I have a lifelong series of patients that come in to see me in the hygiene recare column, and they're coming in every 3, 4, or 6 months into my chair, I've spent the time up front. I've front loaded them with why fluoride varnish is important. They know what a local delivery of an antibiotic is. So I've already trained the patient, so to speak. So when I do my perio assessments and my patients hear those localized bleeding fives, they're already asking me, so should I put antibiotics in those areas today? And of course, again, when we're looking to find those magic minutes, oftentimes it's how do we find better, more abridged strategies for communicating with the patient, helping the patient to understand the why, so that that choreographed dance, so to speak, between you, the doctor, and the patient are one where it's very symbiotic and we're not getting those kind of cogs in the gear, so to speak. What are your thoughts on that?
I love that. And it makes me think of a question that I think I'm already going to know the answer to is, how important is it for a hygienist and a dentist to orient that patient and set expectations right from the get-go? So I love your concept of front loading, but then every time I come in as a patient, do you reorient me for what's going to happen that day?
Absolutely. It's unbelievable. We assume the patient knows why they're even sitting in our chairs, and they don't. Half the time they're sitting there like, what are we doing today? And you're like, oh my goodness. So I like to play jokes with my little jokester patients. I'll say, well, we're a proctology office, so take off your, no, I'm kidding. But the whole idea being, yes, we do need to orient our patients. We do need to build value in not just you're due for your x-rays, but rather the reason why we take these radiographs more frequently on you is because Dr. Rice is continuing to evaluate your bone level. You remember that we've been treating this disease. The good news is you're in remission from this disease, but remember, we can't cure it. So we're constantly screening for it. So yes, we've front loaded the patient, and that transformative learning is lifelong. So the patient needs to come back and continue to have those touch points in order to better understand that value, which is a huge piece. And again, again, dental hygienists out there, on average, how much time do we have to talk to the patient? I know we talk about trying to find those magic minutes, but the average primary care physician gets 9 minutes and 36 seconds per patient. Wow. For a primary care appointment. What about our dentists? Our barely 5 minutes, right? By the time you guys are in the operatory, we want you out. Hurry up, get out, right? So hygienists, who are the ones who really do have the time? 45 minutes, an hour, whatever you're gifted in your practice. We're the ones that really can be those patient advocates. And clinical excellence means educating the patient and following through with that care all the way to the end. The end point of your instrumentation is when the inflammatory process is done, which for the vast majority of our patient population is not the case. So we've got a lot of work to do. And I think the more that we can onboard the patient, the better the opportunity we have to continue to find those magic minutes.
I love that. I love that. Okay, so let's wrap up with the question that if I'm a hygienist, I'm asking. So how do I prevent this guy from interfering with those magic minutes so you can stay on point and on track and I'm actually being helpful as opposed to getting in the way?
That's a great question. So I think dental hygienists and dentists, we're like ships passing in the night. Are we not? I mean, it's amazing. Doctors, for the most part, are practice owners. So they're busy dealing with so many other things on top of being clinicians, on top of their own columns. And the irony is, for the most part, unless it's a new patient, those recare exams are just kind of thrown into a hygiene column. And we got to figure out in between doctor doing this root canal over here and this crown prep over here, when we're going to get the doc in. So I think it's important in that morning huddle to even talk about, doctor, I noticed you're going to be in this long procedure. When can I come and get you? Anything that we can do to front load it. So again, finding those magic minutes for me as a hygienist is me already telling the patient, I'm concerned about this tooth up here. Do you see this, fracture in your silver filling? Dr. Rice is definitely going to be concerned about this. My gut tells me he's likely going to want to do a full coverage crown. So I'm talking to the patient about it up front so that the doctor can come in and just nod and leave. I think a lot of this too is doctors tell us what you want. Do you want us to set out your gloves? Do you want us to set out your mask, right? Let us know. Do you want us, some doctors want me to go through the whole thing. This is Susan. She's got high blood pressure. She's on atorvastatin or whatever. Some doctors want that. Some doctors don't. Some doctors want to have that conversation. Yes, we're doing that mumble down the hallway, right? Like, okay, and here's Susan, and she needs that crown on number 3. So I took a picture of it. And she also has periodontal disease. So I treatment plan, scaling and replaning. Okay, go. And then we throw the doctor into the room, right? But we have to reorient the doctor to it, right? So doctors let us know. My doctors love it when I say, this is Susan. She has stage 3 periodontitis. We've already talked to her about laser assisted osseous. She's ready to rock and roll. Doctor, what other questions can I answer for you? Right. So again, that symbiotic relationship back and forth, but oftentimes we assume that we can read each other's minds. And the reality is we can't. So hygienists, ask your doctors, what do you want? Doctors, be very clear about, this is precisely what I need to make the exam more efficient. And sometimes that is bringing the doctor in early on in the appointment. Yeah, even in the middle of the appointment. I'm a hygienist that, hey, if I can get the doctor in there, I will stop instrumentating. Come on in, doc. So that of course helps add those magic minutes onto the appointment as well. It certainly gives us a much more organized chaos, so to speak, within the dental practice.
I absolutely love it. So patients need orientation. Clearly, I need help, but we'll call it orientation for today. Katrina, you are awesome. If you're watching this and you are a dental pro and you have questions, shout them out. We'll follow up. And hey, if you're a patient watching this and you're trying to figure out how you get your magic minutes in this whole thing so we understand what you need most from us, please let us know. We're here for you. So till next time, I'm David Rice with
Katrina Sanders, the wine hygienist.
We'll see you guys next time.